Hi everyone, welcome to Tea Time with B and Kit. I'm B,
And I'm Kit.
and in this episode, we're talking all things health.
Health is wealth, and this is one of the most important things that you can focus on, especially as a woman. We don't tend to focus on us, and a lot of times we prioritize everything else. Maybe it's your job, your fitness, your kids, work, whatever it is, but we don't prioritize that. So B and I came together and we decided that we have a list of doctors that you must see.
Mm-hmm.
So to kick it off,
Yeah.
B, what are your recommendations?
So first things first, I'd highly recommend a general practitioner, which in America is a PCP, so your primary care physician, and go in for your at least annually,
Yeah,
at least.
that's one time a year, you
Yeah,
guys.
one time. Get your labs taken, get all the other bits and pieces that you need to check off, get that done, and just make sure that, you know, your engine is working correctly. So definitely go do that one.
Yes. The next one is I highly recommend it is I mean every woman needs this is your gynecologist
Yeah.
or your OB-GYN, especially if you're looking to have kids. This is going to be essential for like all things what's going down there. Think about your your woman area as your engine. That's what gets everything going for you. And it's really important for you to go get checked out, especially if you're like dealing with bad periods. Like I firsthand know how that was, um, and is. And then also, if you have any kind of funny feeling down there, if it smells or whatever it is, and like we're women, we all know, we get it. So make
Yeah.
sure you have. And honestly, like when you're going to doctors, the one biggest thing that I think is you have to interview your doctors. Make
Yeah.
sure you vibe. Make sure that these especially for these two doctors is like
Yeah.
make sure the vibe check is real. Make sure it's somebody that's going to advocate for you. And if you get weird energy, something's off, then go find another
Yeah.
doctor because
Because it's not you, it's them.
100.
Yeah, because sometimes doctors are in a place of power and
Mm-hmm.
they use that to the advantage and make you feel lesser than, and you just take their word for it. But if you don't feel comfortable, get another one.
That's it. There's so many out there. Ask your friends, ask your doctor who they recommend because that's the only way
Yeah.
you'll know what's
Mm-hmm.
going on.
Yeah. 100%. Make sure when you do go to your OB, get a pap smear.
Oh, a
You
hundred
know,
percent.
um, if you're sexually active, regardless of whether you and your partner have been together for years, still get checked for STDs. You just never know. Something could be lying dormant. You could get
Mm-hmm.
sick, and that could kickstart something in you. Um,
Even I know that most women after the age of 40s, you start getting those mammograms done. Get those done.
100.
Also, if you're in your 20s, 30s, and even your 40s, get your fertility checked. That's one big thing that a lot of people have don't do is
No,
they
I
don't.
think women take it for granted.
Yeah, we all think, I think that there's just stigma there. Like for me,
We'll say yes.
it's like when I was younger, I was so scared about if like being sexually active, it's just getting pregnant. And,
Mm-hmm.
that's like the stereotype is like, you don't want to have a baby young. But then
Nope.
also it's like, can you have kids? That's like for a real question too. And so
Yeah.
make sure you get all those tests and then also advocate for yourself. Like, you can even put your test results in chat GBT or you can Google what things are.
Get a second opinion.
Yeah. And you don't have to trust like everything the doctor says right away. Like
Literally don't.
you
I
don't.
mean, she can tell you that.
Yes, like,
Mm.
look, like, I've
Especially
been,
with OBs, like, mm-mm.
hmm and for me, like, I hated when OBs gaslit me. I had bad periods ever since I was little, and um, literally, I had a condition. I had a condition that it was causing me to get deathly ill, and I went to I think over 20 like OBGYNs all over the Dallas Metroplex. Like I went to downtown Fort Worth, Dallas, all over the city that I live in, everywhere. Like I would drive. And I even like I had one doctor like last year, and I liked her until shit got real. Instead, as soon as I started having issues, she wasn't able to assist me, and I think that's where I was the most disappointed. But like I found a gem of a doctor, and I'm just gonna give her a shout out because I love her so much. Her name is Dr. Slavis, and she is in Rockwall. And I know it is a drive, but listen, if you only need to go if you don't have any issues, you need to go to your doctor one time, and
That's it.
this is it, and
And
like
don't keep putting it off. And I know, like, especially younger women always put off going to see an OB or going to see their doctor because, they feel like it's embarrassing. But
no.
girls, if you're willing to take your knickers off for a man for pleasure, you need to be able to take your knickers off to make sure that it's healthy because you just never know.
And also like STIs spread through like even the toilet seat, like HPV, you can come into,
Yeah, it's just be careful,
mhm,
and you need to see these doctors on a yearly basis just to make sure you have all your bases covered and you know that you're in good health.
100%.
Um, and have these conversations with your OB about birth control and all of that. Don't be in the dark. Don't feel like you can't speak up and ask the questions. Um, Especially if you feel like particular contraception isn't working for you.
Guys, that's another thing. Like I remember I took when I was young, I took Yasmin or
That
Yaz.
was really popular in England too. I remember that. Yeah.
And I felt like I was an evil person when I took it. Like it messed with my hormones so bad that I was mean. And I just couldn't like I couldn't come to grasp like why. And it was like the birth control.
Yeah.
And so and then honestly like too is if you don't want to take your birth control, that's okay, but advocate for yourself because the first step is a gynecologist is always going to put you on that birth control. And if you don't want to take it, advocate for yourself. Be like, hey, look, what are my alternatives?
Yeah.
Like last year, I remember my doctor, I had 3 options for my condition. And we tried the first one. But I met with her the nurse practitioner because she was out. I think that doctor was out, so I met with her nurse practitioner, and she came in and she had like no emotion, and she's like, "Well, this is it," and I was like, "Okay, unacceptable. Like, what are my other options?"
Mm-hmm.
I was like, "We're gonna sit here and we're gonna discuss." I was like, "What are my other options? Like, how are we gonna handle this?" And the lady was, she was taken back. And at first she came at me kind of strong, like, okay, well, this is it. And trying to get out of there, trying to rush me. And I was like, no, honey. And first of all, I came here at take time out of my day to come to see you. And you're giving me like unacceptable answers. Like, what are they? And I think you should always advocate for yourself. Use your voice. If something doesn't feel right,
Mm-hmm.
then you have to speak up.
Yeah.
And this goes for all doctors.
Yeah.
The next are going to be, preventative and specialized care. I mean, these are going to be you have your first line of doctors that you need to go. This is like your core team, which
Mm-hmm.
B mentioned is your PCP,
Mm-hmm.
and then the gynecologist. Next up, B, what are
So this is somebody I've taken my kids to and myself previously in the past, is dermatologist. That's somebody I feel like for any kind of acne concerns, eczema, or any kind of skin related issues, um, go and speak to your dermatologist. And I know 2 of my children have eczema. I've had to deal with like acne problems for the longest time in the past. And I feel like I'm dealing with them now. And I feel maybe I'm in like
a
perimenopause.
perimenopause?
Yeah.
Mm-hmm.
So I may also now make an appointment with the derm to figure out what's going on with my face, or just find topical ointments or something to put on it. But I highly recommend seeing a derm for anything skin related.
Even guys, I think I don't know what the percentage is, but skin cancer is real too. Is
Yeah, okay. Growing up, never used sunscreen ever. I would go out, and all my
mm-hmm.
friends would be worried about putting sunscreen on, and their parents put it on them. and we'd go swimming, and and my mum and dad never put sunscreen on us. And we just thought it was like a white people thing. Um, and it wasn't until I moved to America, and it was my sister-in-law that had mentioned that she went to her dermatologist because she thought what she was getting was freckles. They weren't, they were sunspots. Yeah.
Oh,
So
wow.
her dermatologist was like, this is really common when you have melanated skin because typically we don't use sunscreen. Luckily, I was wearing moisturizer that had sunscreen in it. So I was like, yeah, no, I'll be fine. No, my sunscreen now is factor 50 every day.
Oh, mine too. I feel like I honestly like, people always ask me and B, why do you guys like look so like why are you aging backwards? SPF guys, SPF.
Yeah. Even on the days where I don't wear makeup, like yesterday, for instance, sunscreen, like my moisturizer and my sunscreen, like I have to. I need to do a better job about reapplying it, but I mean, I don't step out the house without it anymore.
Yeah, I mean for me too is like I put it's and look like this is like skincare needs to be simple. You get a good cleanser for your face, toner, a moisturizer, eye cream, SPF.
That's it.
That's it.
You
But
don't need all the plethora of all
yeah,
these influencers are trying to like shove down your throat. It's
no,
really not
you don't
necessary.
need all of that like
Mm-mm.
salmon sperm and blood
And snail
plasma.
bullshit.
Oh,
Nah, we don't need that.
no.
Keep it simple, stupid.
Yes, yes.
Right. What's next on the list?
Dentist, you guys.
Girl, yeah, that should also be more like a core thing because these things are hella expensive to replace and fix.
That and then also it's whenever you can get like an infection or bacteria in your mouth, that spreads in your bloodstream so fast.
Yeah.
And like honestly, like I think having nice and clean teeth, like it's part of being hygienic. And you have even if you just go once a year, make sure you have no cavities, whatever it is, just go because and oral health is also linked to the heart health too. Did you
Yeah.
know that?
Yeah.
Yeah, and so make sure you take care of your teeth because that's the first thing that people see when they talk to you is like people are going to look at your mouth, they're going to see your mouth
And
moving.
they can smell your breath. And that sometimes if you've got an infection or extra plaque or
Like
you haven't brushed your
halitosis,
and
yeah.
if you don't clean your tongue or brush your teeth correctly, like it all sits in your it sits in your breath. So
Mm-hmm.
good health oral hygiene is like definitely important, and go and see a dentist. I don't like the dentist.
It's that drilling noise, but
No,
like,
I just don't like. I've had a bad experience ever since I
oh,
was a kid, and I do need some work done to my teeth. I just won't go.
I had a similar. I love, okay, look, I went to my dentist when we moved here when I was 2. I went to my dentist until he retired last year. But in between, I had a friend. Well, she's like an ex friend, but she and her husband opened a dental clinic and they took advantage of me. Like, dentist office are dime a dozen. And
Mm.
you have to be careful about these beginner dentists.
Even in England, it's the
It's
same.
like a dime a dozen, and then they take advantage of you. And they're telling guys, I never had a cavity until tell me why I had like 4 cavities when I went to him. And I went to my dentist regularly. I flossed twice a day. I brushed my teeth twice, and I had 4 cavities. That didn't make any sense. And then when I went to I went back to my dentist. Like they're like, why did you have all this work done? You had no cavities, and we've been seeing you since you were 3. And come to find out, there's been like a lot of like investigations. A lot
Well,
of
this
these,
is the thing. When we were younger, we used to go to this one particular dentist, and I still remember his name. I don't want to repeat it because it gives me shivers. Um, and then he um, was then reported and under investigation, and come to find out that he was diagnosing his patients with cavities, or
yeah.
they needed extractions or root canals, and charging the NHS or having them pay privately for dental work that wasn't required. And
Mm-hmm.
and ever since then, I've just never found a really good dentist, and I've just had really crappy experiences. So now I'm like, I need to go and see a dentist. I'm just not gonna go.
Same. No, I mean,
Yeah, I
I'm
don't
looking.
trust him, and I'm like, unless I'm like in actual debilitating pain and I can't function because toothache is no joke.
Yeah.
I just like, I'm fine. I know I had to get a tooth extracted one time, so I need an implant. I need a couple of cavities taken out and replaced.
I feel, yeah.
Yeah, so I'm just like, nah, I'm not gonna have it done. I'm not gonna have it done in America, that's for sure. That the cost of getting your teeth done is like arm and a leg. So definitely, if you have nothing wrong with your teeth, just go regularly. Even if you've got something wrong, just go. I have a fear that's something I have to work on.
And you will.
Yeah. Maybe.
But no, but me and I need some good So if you guys live in a DFW area and you have a good dentist, let us know.
Yep.
Optometrist is the next one. Look, your eyes, your vision can change regularly,
Oh
especially
yes.
now since we're constantly on our phones,
And I'm like an old lady.
constantly on our
Literally,
computers.
yeah.
Like, look, like I feel like that's one thing that you need to make sure is because also your eyes can tell you if you have diabetes, and especially like, I had a really good friend who had diabetes, and his vision started getting blurry.
Yeah.
And
Yeah.
so, I mean, and then even if you have high blood pressure, it can like impact your vision.
Oh, it did mine, yeah.
Yeah, so make sure you guys go get your eyes checked. I mean, and like right now, there's so many cool glasses brands. You can do contacts, you can do LASIK, but make sure you get your eyes checked. Your eyes
Yeah. Your vision
provide you,
is so important.
yeah, vision.
Mm-mm.
And these are like going to be like your top ones, like top five kind of doctors to look out for are
Yeah.
these.
Yeah.
The next are going to be, more of a supportive role.
Yeah. Like specialties.
Mm-hmm.
Yeah.
So B.
So endocrinologists
Mm-hmm.
are important within their own realm, and they will help you with they take your blood and then check for hormones and check for all these. They do take different kinds of blood panels, don't they?
Yeah, they do.
Um,
You can do your thyroid,
yeah,
like
all different blood panels
mm-hmm.
to make sure you're not deficient in anything.
Also like especially women. I think that like now that I'm 40, you're in your 40s. I think that you know we need to start thinking about like menopause, perimenopause. What does that look like? Like our
Mm.
hormones causing us to feel certain emotions and feel
Yeah,
strong emotions and
like like walking into a room forgetting something. You're hot and cold.
girl, the hot flashes are for real and like
Yeah, seriously, like I just thought it was just me just because I'm generally a hot person, but no, like when I get a hot
mhm.
flash, I'm like, okay, this is interesting.
Or even your mental health. Like I think about my mental health too. Is like
Yeah, that
is like
declines.
my emotions linked to my hormones. Yes, so it's something to look out for because we don't realize like a lot of times like the food that we're consuming don't have all the nutrients that we need.
Oh no, we're in America.
So that's something to think about.
Mm-hmm.
The next one is so important,
Yeah,
especially if you have an inkling of anything, is your cardiologist.
yeah,
And
especially if you have a family history of like heart problem and heart disease.
And I know to me, when I think of like everyone on this list, I think the cardiologist sounds most like intimidating and scariest. But look, that's the number one number one killer for women is heart disease. And honestly, even if you're young and you have that, like Lebs B mentioned, the history of heart disease, go make sure you're doing stress tests, making sure that your heart is healthy,
Mm-hmm.
and any kind of inkling, go and get it checked out because heart attacks for women look a lot different
Different
than
to
a
men.
men.
Yeah, 100%.
Mm-hmm.
And I didn't know that.
I didn't know that
I
until
thought
recently
a heart
too.
attack is a heart attack, but it's not.
It's like impacts your neck and your shoulder. You get
It's more like
pain.
a silent killer.
Yeah.
We won't know.
No.
Kit had just literally now mentioned this, but a mental health professional or like a therapist or what they're called,
A
psychiatrist,
psychiatrist.
yeah. Um, alongside physical health, your mental health is so important.
1,000%. I think
Yeah,
this is my opinion, and I think like everyone needs some sort of mental health. Like It's whether it's a life coach, a
Yeah.
psychiatrist, a therapist. Like I had all a therapist, life coach, and like lots of different elements because when we're little, we don't realize like how trauma can impact us,
Hmm.
and then just navigating. And also it's stress management, even if things that you may not think or like somebody else may not deem, it's look, whatever your trauma is, whatever your stress level is,
Hmm.
whatever healing that you need to go to, you need somebody to pour into, and that's going to give you real advice. Because sometimes look, your friends are going to go through it too, and as long as I know we want to dump everything, trauma dump everything on our friends, but sometimes you need the outlet just to release. And also we have so many suppressed memories and
We
like
do. And it's nice to talk to somebody that will give you an unbiased opinion and give you a different perspective, because as much as your friends are willing to A, listen, B, they're going to give you advice based off of knowing you, knowing your
mm-hmm,
situation, knowing what the outcome possibly may be. And you need to be able to talk to a third party that doesn't know any of that. And it's literally just dump all your trauma, get it out
mm-hmm,
your system, and then have somebody else who's a professional that
mm-hmm.
can then give you outlets or ways to deal with things and give you advice that way.
1,000%. Sorry, 1,000% is. I think that that's one of, we focus so much on our physical, but we also need to focus on your mental too, because
Yeah,
that's the one that's like the captain of your whole entire body is that's
yeah.
one that's steering you. So
Mm-hmm.
make sure that you have, and like, look, again, all of these professionals, interview them, make sure that they're a great fit for you
Yeah.
because I went through a stage where I was like interviewing therapists and I had one lady and we just didn't connect. And I think we both equally separately went our ways. I think I had like one or two sessions with her and then we both equally went our ways because there's no connection there.
And that's okay.
And that's okay. Look, you need to advocate for yourself. And
Yeah.
then whoever you have, like whoever you have, like especially your healthcare team, needs to be people that you trust. Need to know that they champion for you, they advocate for you, and they're there for you.
Mm-hmm.
Somebody who can be like, "Hey, can we set up an emergency appointment? I need to just talk," whatever it may be.
Yeah. So the next group of healthcare providers that we're going to speak about are all lifestyle and possibly holistic care as well. The first one is, I've never actually met with this kind of person, a nutritionalist or a
Mhm.
dietitian.
I have, and I had a nutritionist. She's great. Her name is like Eat, Pray, Nutrition. Amazing woman, and she talks about like proper healthcare, nutrition, like what's going to be good for your nutritional needs. She actually got me onto digestive enzymes, like because my body wasn't processing gluten and like milk and dairy and certain foods the proper
Mm-hmm.
way. So she got
Okay.
me onto that. We did a whole thorough blood panel, and then she gave me like recommendations based on that.
Mm-hmm.
Um, Especially if you have like allergies or if your weight has plateaued and you can't, like, you're just like, what's going on? I'm working out, I'm doing everything right. Like
Yeah. It could
sometimes,
be something that you're eating that's
yeah.
like, yeah, stopping you.
Or like, for me, it's like I'm really bad at like, how like it's like the resting, like figuring the science between how many calories that you needed to eat.
God, don't
And
ask
I
me.
would eat like lower than, I think for me it's like I need to eat like between 14 to 1500, and I was eating too less, and so my body was constantly being in starvation mode, and so it was like holding on to that weight. So there's a complete science behind it.
Mm-hmm.
If you're going to find a nutritionist, make sure that they have the qualifications, they know the science behind how food fuels your body, and
Mm-hmm.
also find somebody that you're going to click with. And nutritionist does not have to be a person that, it can just be like a one-time thing, and then once you understand that science, you can, like you can split, like they understand that like that relationship is gonna end.
Mm-hmm.
Next one is going to be PT, physical therapist, or chiropractor. um I haven't been to a chiropractor in a while, but I know that it's so important because it helps with your posture, pain
Yep.
management. you get misaligned, especially when you're, sometimes when you're too sedentary or stagnant, or if you work out a lot. So I know B, like you have,
Yeah, I go to chiropractor at least. I try to go once a week. Um,
she's good about it.
yeah, and one of the trainers that I got to meet last year had mentioned that going to the chiropractor is also a great form of recovery.
Mm.
So I was lifting a lot of weights last year, and going to the chiropractor definitely helped with my recovery journey. And I mean, I tell everyone to go see a chiropractor.
She tells me all the time. I mean, like we drove past her chiropractor
I was like,
building,
I go
and she's like, she's
here.
strong. And she's
She's
like,
strong.
oh
I was like,
man.
I love my chiropractor, and
I mean, do you want to do like a little shout out to her?
I mean, I go to the joint chiropractor.
Yeah.
Yeah, the one where I live. If you know where I live, you know where to go.
Yeah.
Yeah, they're just brilliant,
Yeah.
and I've had issues with my hips ever since I was pregnant with my twins, and
Mm.
they help me with that. I get carry a lot of stress and trauma in my shoulders too, and then I get pain in my shoulders and in my neck.
Mm-hmm.
And they help relieve that. And then I do jujitsu, so everything is all messed up because of that. And then they just put it back together, and then I
Yes.
go to jujitsu, and then it's all gone out of whack
It's gonna
again.
do right.
I
Yes.
highly recommend going to see a chiropractor. And I mean, people
Mm-hmm.
tend to go when they're in pain. I look at it as preventative.
I mean,
I don't want to have
you're
problems.
1,000%. I'm laughing because I remember
What's so funny?
I went to this chiropractor,
Uh huh.
and it was like this. She was an amazing lady. Okay, so I get into her office, and I think I'm like frazzled. There's a week. It was like a weekend, and it was like early morning, and it was during the fall because like as soon as the fall hits, I start playing at my booties. And the guys, I have like a shoe collection, which we'll talk about another day.
Oh, I think I know
But
this story.
I had two black booties, and one was, and I go there, and I was walking funny. I thought it was like something wrong with my body, and so and I lay on a table, and then she goes, you're wearing two different type of shoes.
Yeah, because you lay down, and the first thing they do is like you lay forward, and then they look at your alignment to see like how your hips are. And typically for me, my hips are never straight. I'm always off tilt. So I can tell by the way they put my feet together. So she probably looked at your feet. This crazy lady is like, like,
wearing two different type of booties.
like what's wrong with
Oh
her?
my gosh,
How
it was so,
funny.
and like I think that was probably like one of my top 5 embarrassing moments. Like I walked out of the house with two different type of boots, and one was a wedge, and the other one was like heel. So it was like, and I was like lobster. I mean,
She
thank
didn't need a
goodness. Like
chiropractor. She needed to get a brain scan.
so funny.
Next one is
Next one.
yeah.
Okay. Oh, that's you.
Oh,
Wait.
so integrative and holistic therapy, or a doctor of some kind. I've been to holistic doctor.
Mm-hmm.
They're interesting. Um, I've had acupuncture. I've had
Mm-hmm.
I've taken herbal medicine, like naturopathic or whatever it's called. Um, if it works for you, then definitely do it. I have tried some. I have. I think there is a place for it. Um,
I've been to, yeah, like to just kind of lean on to you is I've been to, yes, like I think that I've been to massage therapy that was holistic. It was like very in touch with like earth. I think I've been to acupuncturist.
mm,
I've been to a holistic nurse practitioner who did like look, they give you great blood work, and they do blood exams on you that will give you different kind of different like readings, different readings. If you're all about that and you love that natural care,
yeah, I
100%.
highly recommend that. I've had cupping, all of that, like everything in that realm.
Mm-hmm.
Um, there's definitely a place for it, but I think it depends on what you need help for.
100. I think that if there is like a doctor that's like a holistical doctor that you've been wanting to try out, try it out. I saw this like lady who does it was on TikTok, and when I was scrolling through, and she does like these massages, and like she releases like your trauma by tapping into your energy field. I mean, look, like if it were, I mean, it seemed really cool, like what she was doing,
Mm-hmm.
but if it works, like cool, like I haven't, there's a lot out there, but also, again, interview people
Yeah.
before you go out and just trust what everyone's saying.
Yeah.
I do
Mm-hmm.
want to put a caveat. This is just my opinion, you guys. Is that a lot? Like some of it, like some the one doctor area that we're going to go through that you need to be the most careful about is a holistical doctors,
Mm-hmm.
because you know the other ones, some of them are they're backed by science, and this one, like, just be careful, trust your intuition.
Yeah, because sometimes you feel like you may be on your healing journey, but it could just also be placebo,
100.
and I'm not saying that they don't work because I have been to
100,
naturopathic and,
yeah.
taken their medication, um, but I don't know which medication was working because I
Mm-hmm.
took a lot of different things. And I don't know if it was just placebo or if it was like, because I suffered from cystic acne when
Yeah.
I've lived here in America last. And I don't know if it was like the skincare, whether
Mm-hmm.
it was the change of my diet, or
Mm-hmm.
whether it was the naturopathic medication. So it could be a mixture of all three,
Yeah.
or it could just be placebo when it came to the
Yeah.
naturopathic stuff. Um, I'm very much like, try herbs and things first, and then if that doesn't work, then get the drugs.
Yeah, like you should know your body, get to know your body, and like whatever works for you, then yes.
Yeah,
And
like,
so
what did they do back in the olden days?
they do herbs. Like, I
Yeah,
mean,
all the herbs, the oils, the butters,
mm-hmm.
and, making all these like different concoctions for you to either put on topically or like
I mean,
digest.
yeah, they would use like the little leeches and suck out like all
Yeah, like all the things. Like
things
when
from
my
your
kids
blood.
get sick, I do um, honey and or onion juice, or I crush up garlic with honey, or put black pepper and honey. I try all of that before I give them
You know,
actual medicine.
even like I feel like in our culture we have like, like for
Oh
me
yeah,
it's
we're
like
definitely blessed that we have
yeah,
the teachings of the elders of like using like
yeah.
turmeric and a lot of things.
And then also it's like, when we're sick, or like I know whenever I was younger, when I was sick, like my mom made me this like drink, and it tasted disgusting. But look, it helped get rid of like that cold and that cough inside of it. And it was like it's called like Rob or something like that. It's like made out of some seasonings. But like it does, like there is some, like
There is a place for it.
yes,
Yeah.
like 100%. Like, and my whole point is like with holistic, when you meet with a practitioner, get to know their background, get to know where they're
Mhm.
from,
Yeah.
get to know where they're teaching, where they learned it. And then there is like, there's truth to it. And then there is sometimes, like, I just want you guys to be warned. It's like there is sometimes false people.
Mhm.
Um, Also, some other ones. I want to add this one in is an allergist.
Oh yes.
Mm-hmm.
Yes.
Is I went to an allergist. I remember this is during 2016, during 2017. I had gained a lot of weight, and I was like always just like couldn't breathe. I was working out twice a day. I had a gym at my workplace. And then I was cooking all my meals. I was cooking everything. So I would eat like a little piece of like chicken, salmon, cook everything in coconut oil, ate sweet potato for lunch. And you guys, I met with a nutritionist because I was free with where I worked. So I did like everything, but I was swollen and my weight wouldn't budge. And I remember one day I climbed, it was just like one set of stairs, and I couldn't catch my breath. And I was like wheezing, like huffing and puffing and wheezing. And I was like, something's wrong with me. Like, something's not right. So I decided to go and find like an allergist. And so I went. And I remember when I was like working, actually, when you and I were friends, when I was working as a decorator, our friend, he had told me, he was like, I bet you might have celiac disease. So look, I cut out gluten from my diet, I cut out dairy from my diet, I cut out everything, but I was still couldn't breathe. And I was like, something's not right with me. So I signed up, I scheduled an appointment with this allergist. She told me the very first thing, she's like, a lot of people have like food sensitivities.
Mhm.
You might just have a food sensitivity. It's very, very rare that you have food allergies. Guys, I got that panel. I got plucked. And so they did two panels. One was like environmental, so the ragweed. I had like a ton of those. I came back. So lots of allergens from outside. The second was the food panel. When I got the panel results back, like my back was itchy. I was heavily allergic to coconut, sweet potato, which were, and then it was like barley, which is like, it's in some like bread products, and buckwheat. Like four things caused me to trigger, and dust mites. But like, that's like my number one allergy. But like, I was basically killing myself by what I was consuming. And my body was so like, was protecting me. And that's why I was like getting those asthma. And that's why I had like so much heavy cortisol, because my body was like in overdrive. And since then, I recommended this that the allergist to multiple people. Like, I mean, I saw those results, and it literally, the minute I started cutting that out of my life, is I was able to breathe. I was able to do things, and now when I have something with coconut in it, like my body kicks in, and I know I'm like, oh my gosh, I had coconut. I need to take my Benadryl, or if I had sweet potato, like your body will tell you. So really, I think that that's something that you should try. Like everyone should go and try. My
Mm-hmm.
sister, I actually sent her because she was having like some kind of issues too. She found out that she had gluten allergies,
Oh,
and then she's allergic to like milk products. So yeah, so she has to be like really careful. So that's something that if you suffer with like wheezing, allergies, even, girl, you know, it's like another telltale sign is eczema. I was getting tons of eczema on my legs, on my lips, and like different places, and that was a telltale sign I was allergic to foods. Um, Next up,
so we have a group of specialists that we recommend for you guys to see, and this is more of a, like we say, specialized doctors. So having going to a mammogram center or going to see a breast specialist, and Kit had mentioned it, especially if you're over, like once you turn 40, you should go and get a mammogram done. Um, and if you have any form of breast cancer history in your family, um, I would say go and have a screening done before you're 40, just as a preventative measure. I mean, there's no harm in getting your boobs checked. And definitely look into how you can check at home. Like your armpit is supposed to be in, not a dome. So that's why it's called an armpit. So when you raise your arm, it should go in and not out. So if your armpit is puffy, that's a sign. That's not a good sign. Doesn't necessarily mean it's a
wow,
bad sign. It's just not a good sign. You could just have a lot of like lymphatic issues where you're not draining very well. Um,
that's another one right there too, B.
oh yeah. Um, check your boobs
Mm-hmm.
and check your armpits. Check up near like your clavicle and around. Not just check your boobs. Like check here, check down and around.
That's really good because I personally like, I don't check my underarms too. It's like, we just look at
Yeah, because
we
you could have something here which it still would count as breast cancer or like related to that area. And if you don't
Mhm.
know how to, there are like a million and one videos out there, either on YouTube or on TikTok, I'm assuming, or Instagram. Um, but if you're going to see your OB on a regular basis, they check your breasts.
They're gonna check
And
you.
then
Yeah.
that's why they check around in your armpit area to check for lumps or to see if your armpit is puffy.
You make a good point. I had a friend who had breast cancer, but it came under her armpit. And so,
Mm-hmm.
yeah, I mean, that's a good point, is
Yeah.
if there is any puffiness or,
Yeah, and just check, just watch a video so you understand, like for the signs, or if your boobs are itchy, or if you have a rash, or like some women get like a cyst on their breast. Sometimes that's really common, and it could be nothing, but it also could be something. Um, because I know someone that would get a cyst on their breast, and they would like literally drain it themselves because they've had it checked, and then they know that it's not a problem, and it's all hormone related, and it would grow, and then it would go away, then it would grow, and then it would go away. But definitely highly recommend just checking your boobs when you're in the shower. It's like a 5-second thing.
I actually, I remember this one time. I it was it was like 2 years ago, actually, 3 years, 3 years ago. I started getting this sharp pain in my chest, and it kept on heightening. And mind you, there's this one day in particular, I went to the office because I had a meeting with like our head boss. No one else was there besides me on my team, and
Oh, I
so
remember you telling me this.
yeah.
Yeah.
And I got a coffee from Starbucks, went there because I was like, I'm tired, but I have to be here. And I didn't know what time the meeting was. And so I was waiting and waiting. And so I was like working, doing my thing. And my office was in the back. The whole day I started getting this like sharp pain in my chest. And guys, I was freaking out. And so it was triggering me to get like anxiety because I do have heart disease in my family. So I was like, I'm so young though. Like, what is going on with me? And I ended up having that meeting, and throughout the whole meeting, I was having like these like pains in my chest, you know. And guys, we think that our heart is here, your heart's in the middle,
Mm-hmm.
and so and it was like there, and so I was like, oh, I don't know what's going on. So then, as soon as I got done with the meeting, I left, and I ended up going. I took myself to urgent care to go get checked out, and I was like, they would probably know if something's going on with me, especially with my heart. They ended up doing an EKG on me. They're like, your heart is fine. But then, like, I ended up having to go get a mammogram done. And I ended up having like a ton of cysts in my breast. And they were being triggered by caffeine. So caffeine was giving me like this, like, it was like this, like, sharp pains. And that was like so close to like my heart area.
Mm-mm.
So my whole point is like listen to your body, and like exactly what B said is like check your breast, see if there is any like lumps, any kind of cyst, and go and get those checked out because you never know. I remember when I was 15 and a half, 16 years old, I actually had it was like my first job, and I was like had this internship at the bank.
Mm-hmm.
And there was like this, at that age, like there was like this younger woman, like she was like in her 20s, but she's older than me, and like she was gorgeous, like this gorgeous Indian woman. She was probably 23 at that time, so she's like older than me, but I like loved her. Come to find out, she was dealing with breast cancer at that young age. So you're not like disease does not discriminate.
God, no.
So just make sure you get checked. If you see like a mole, you see something itchy, like a
Yeah,
said.
any discoloration of what the skin looks like, anything. And again, go to see your PCP or your OB and take it from there. It's especially South Indian women are never taught this. It's not something that is spoken in our homes. It's very much hush hush, and you deal with either fertility problems or any form of like women's health issues on your own. And it shouldn't be that way.
Mm-hmm.
And
Mm-hmm.
we've, I know for sure in my family, it's always hush hush. We don't talk about it openly.
Mm-hmm.
It's There's some form of shame around it for some reason.
Yeah.
Like, I don't understand. Like, this is just a part of being a human woman. These are the body parts that I've been given. And if I need help, why is it so much like why is it such a taboo like subject? Like if I have to go and get my boobs checked, or if I need to go and have a pelvic exam.
I agree with you. As somebody who faces like infertility or fertility challenges, um, you know, I never realized like what a taboo topic it was until people who were close to me were facing it. And this is like years ago. And I remember when I was in junior league, and I think it was 2018, 2019, I was an education chair.
Mm-hmm.
And for education chair, we were supposed to do so junior league, you do volunteerism as well as leadership training. So my job as education, it was like to figure out all the programs, bring in speakers. And my number one attended like group meeting was the infertility, like fertility topic.
There you go. Because again, and I'm sure this is like
It's
over all cultures,
yeah.
that it's very much hush hush, very taboo,
Hmm.
and some women feel embarrassed talking about it or opening up about things like that because they may not feel like they're getting the right support, or they don't know who to talk to, or
Hmm.
what kind of help that is available.
Yeah.
And it's such a shame because then you leave things undiagnosed and you are the one that has to suffer the consequences. And it's such a shame because we just think, oh, it'll go away. Or, oh, I will call the doctor. Don't worry. I'll go. You never do because there's shame, stigma, all that other bullshit attached to it.
Yeah. I mean, honestly, I think that if you're in your 20s, 30s, even 40s, go and like if you're looking to have children, go and get that checked out.
Yeah.
There's nothing wrong with that because
And there's nothing wrong with you.
there's nothing
I
wrong.
think this is a thing that you think that there's something wrong with you, and us women, we kind of internalize that and we think about it way too much, and then we don't go.
And even if there is something wrong with you, it's okay.
Yeah, you deal with it.
There's so many options out there. There are different treatments. There's so many different ways now. Like technology has advanced. We have AI. Like we have even in China, I think they're like making those machines that you're able to. That's they're working on bearing children for people, like as a form of surrogacy.
That'd
I
be
mean,
cool.
there is so many different kind of treatments that are going out there. Stem cell research, like there's like look, go get yourself,
Yeah,
go put yourself first
first,
at this point because
literally.
this is going to be important because guess what, your health is wealth. Like I had an amazing boss that once told me like I used to not take any sick days. Like I remember at this one company when I left it, I was there for 5 years, almost 5 years, and like they let me go whenever it was COVID, and so they didn't care about me. But when I left, I had like 180 hours of PTO. I never took a sick day. And I got paid out half of that, like a little bit less than half of that. And I let like I had over like 4+ weeks, almost 5 weeks of vacation that I should have taken, and I didn't. But guys, that's what I'm just saying. It's like health as well. Like
Yeah, make that time for yourself.
make that time,
It's
make
so
those
important.
appointments. Like even if you take anything, make sure you have a good gyno and a PCP.
Hmm.
Your PCP can even do this past years for you. Like make sure you go and at least get those blood work done because you want
Hmm.
to know what's going on internally with your body.
Yeah.
And a lot of times you might be great on the outside, but the inside you never know. Like
No.
and so make sure you're getting all of those checks done and add that to your self care plan. Like we talked about that, having that self care routine in our
Yeah.
last one of our last episodes. Add that in
Yeah.
because
Go
it's
and go.
so.
Go get yourself seen to whoever, which person you need to go see, but get seen. That's
Mm,
really important. The next person on our like specialized list is something. I mean, I wish I'd went to go see myself. I don't really think I need to see them now. But is a pelvic floor therapist. After bearing 4 children and twins being my last pregnancy, your pelvic floor goes through it. Even though my last two births were cesareans, they I had big babies, and obviously like my last two were twins. They pushed a lot. There was a lot of weight on my
oh,
pelvic floor. Um, and most mums will tell you that your pelvic floor isn't the same.
mm,
Um, so I'd highly recommend going to see a pelvic floor specialist. And also, not just postpartum, I think, again, there's a lot of stigma and shame built around if you have incontinence problems.
incontinence, also endometriosis, PCOS. Like if
It's
you.
all in that region,
Mm-hmm.
and sometimes it's connected and you don't realize. So, yeah, pelvic floor therapist is something I think a lot of women don't consider is an option to go and see.
Yeah, and I really think that it's important for like making sure that area is, like making sure that there's nothing wrong with you if you have income. Like I think about it, income. Continence.
Incontinence, yeah. If you have
Yeah.
incontinence problems, if you've got postpartum issues, there's nothing wrong. It's all very much normal. And if you have any form of intimacy issues,
Yeah.
especially like if you have pain during sex, stuff like that, like I definitely would recommend going to see a pelvic floor therapist. Yeah.
It's 100%. I mean, these are just like those extras. Like,
Yeah, these are like, like only if you have those problems. Like if you've got a full bill of health and you don't have any issues with your pelvic floor, there's no need to go and see a pelvic floor therapist. This is just like extra specialists
yeah.
that you need to go see. What about you?
I think the last one I just want to throw out there is a masseuse, like a massage,
I
and
was
like
going to
massage.
mention that.
Yeah,
Yeah.
yeah. And
Yeah.
so I think that it's important, like that plus stretching. I haven't done that, but I know you have.
Yeah, getting stretched like by a professional is game changer. Part of recovery, yes. To prevent injury, yes. Even if you've been injured, they can help you. It's amazing, and it's amazing how much your body is flexible because they're actually the ones
Like,
pushing you
yeah,
to your
see,
limit. And like sometimes when you're stretching at home, you just, oh, I'll just do a little thing here and whatever. No, like it's expensive. I will tell you that. But if you are deep into your physical health
yep.
and you're lifting on a regular basis, this is part of your recovery. I think we should do a video on that.
I think we should, yeah, like
Yeah.
that fitness. Yes.
But Kit mentioned massage therapist. One particular type of massage therapist you need is lymphatic drainage massage therapist. Mine, she's a godsend. Just has like so much knowledge. She's brilliant, and I've recommended her to so many people now. And you don't realize, and you don't have having lymphatic drainage massage that isn't necessary for post surgery. Have it anytime.
Yeah, I've gone in a lymphatic before, and how I felt afterwards, like that post bloat, and it's even if you're having an event, like look, if it's like your birthday or whatever, a lot of people who do pageants and like those Victoria's Secret models, they get those lymphatic massages done
Yeah.
a few days before. That way, it gets rid of all that puffiness of inflammation, all of that, and like you never know it. Like your body puffs up and all that. Like there's water weight retention.
Yeah.
You should do it because it helps getting all that inflammation out of you. And also that puffy, like sometimes that puffiness under your armpit could be where your lymphatic system is drained. Like my face the other day, I was so swollen when I woke up. It was because my lymphatic ducts were I guess like clogged. And so I ended up doing gua sha, and I could hear like all of that like liquid coming when it was being drained.
Yeah.
Because whenever I was doing gua sha, and it's so life changing. I mean, this is like an extra if you want to just continue on with like your journey, with your wellness journey, then
yeah. And if you hold on to a lot of water weight, if you live a very stagnant lifestyle, or if you have a lot of health problems in general, especially if you have a lot of health problems, your lymphatic drainage, like the main key areas, do become blocked. So a massage therapist just kind of eases everything to be drained into one area and activates that point. And I can tell you from first-hand experience, I would highly recommend, if you've never had that, get one done. Your body's going to hurt afterwards, and it's not a painful experience. It's very much a very light touch, but because your body is now internally working, you're in pain. It's insane.
Yeah, you're in pain, and also like sometimes when I've gone like those kind of massages done, like the way your body drains sometimes is through sweat or it's like through your your bathroom, and literally I remember I got massaged and I had to go to the restroom like right away.
Oh, talking about restrooms, another kind of person who's, I think they would be classed as a doctor.
Maybe
I don't
like an
think so.
extra.
And that's definitely an extra. But to go and get colonic hydrotherapy,
Yes.
I've had that.
I've done it too. Be convinced. This is
It's
like right before you left.
yeah, right before I left, and that was part of my journey of healing my acne. Girl, when I tell you the amount of shit literally that came out of me, gas, bile, um, parasite,
Yeah.
and then she like paused the machine as it was like doing the extraction, and she was like, "Do you see this thing? That's a parasite." I'm like, "Oh." And then do you see the little bubbles? That's like trapped gas, and I like can feel it all the time, like when your stomach goes.
I mean, I feel like I have always had choke gas.
Yeah.
My stomach always makes noise.
And she was very knowledgeable and helped me on my journey. And I would see her like once every 2 weeks for like 6 weeks or something. It was brilliant.
I mean, I think there's so many.
Yeah,
other
we're
ways,
both going to
like,
go book a colonic double date.
I mean, yes, I think that'll be so much fun because like it's gonna be like cleansing and. But I like look like if you take away anything from this episode, make sure you have a good primary care doctor.
That's the start.
That's a start. And if you're a woman listening, a good gynecologist. Men also go get your
Hormones checked.
hormones checked, get your testosterone levels, like all the because we all fluctuate.
Yeah,
So,
and then go and have your male men check.
Yeah.
I was like, it was a bit of a tongue twister.
Yeah.
Man check once a year. Get your pee looked at. Go do all that. Yeah, like there's no shame of whipping it out in front of a woman. So why is there no shame of whipping it out in front of a doctor?
That's gonna like look at it just like a body.
Literally, like who cares? Get yourself checked out. Your health is really, really important, and if you want us to talk about a particular type of doctor in more detail, let us know.
Yeah. Or if you want any recommendations for our doctors, let us know.
Especially if you're in the DFW area.
And if you have a good dentist recommendation, both of us need that. And so let us know. Remember, health is wealth. This
Indeed,
is like
it is.
your gold that you have.
Yeah.
But stay tuned. We love to hear from you and check us out every Mondays. We'll drop a new episode. And
don't forget to follow us over on Instagram, TikTok, YouTube, and of course here on Spotify.
Thank you. Bye, loves.
Bye, guys.